Hi there. Thank you for your interest in the Healthcare Team Fitness Tool. I'm Nicole Bendaly, President of Connect and the co-author of the book, Improving Healthcare Team Performance. In this video, you'll learn about each of the 7 elements of a high-performance healthcare team, the 7 elements that are measured by the Healthcare Team Fitness Assessment. Now, I have a question for you. Are healthcare teams unique? Do healthcare teams need to focus on a unique set of teamwork practices in order to perform at their very best than, let's say, a team at a bank? Or is a team, regardless of the industry they work in? Well, we've been helping teams across many industries to up their performance for over 30 years. And we discovered that in order for healthcare teams to perform at their very best, they need to focus on a unique set of behaviors and practices that are unique to the healthcare environments in which they work. We discovered that, yes, of course, healthcare is unique. Healthcare teams need to focus on a different set of behaviors and practices in order to thrive. And so we have designed this healthcare team assessment and this entire healthcare team tool based on the behaviors and practices that we've identified through our research in patient safety, team effectiveness, and effective communication in healthcare to focus on these core set of behaviors and practices. And these make up the 7 elements that are most critical to a healthcare team's ability to deliver exceptional patient care. And the Healthcare Team Fitness Assessment measures teams against these 7 elements so that teams can quickly identify their core strengths and the specific factors preventing them from working more effectively together in the delivery of exceptional patient care. These 7 elements, along with our research, are published in our book, Improving Healthcare Team Performance. And the book is required reading at a number of universities and is also used by healthcare leaders around the world to improve the effectiveness of their teams. So this teamwork model is being taught and used around the world to improve healthcare team performance. So let's review each of the 7 elements at a high level. The 7 elements include healthy climate, cohesiveness, open communication, shared leadership, shared learning, team members' contribution, and change compatibility. Each element is measured by 5 behaviors and practices for a total of 35 behaviors and practices measured by the assessment. The assessment takes about 10 to 15 minutes to complete. And we know that when healthcare teams apply these practices, they experience greater employee engagement, less conflict, better communication, greater trust and respect, higher patient satisfaction, and ultimately better quality care. So let's start by reviewing healthy climate. Healthy climate refers to how team members feel about the way the team functions, including their level of comfort with team norms of behavior. If the climate isn't positive, and you know this, honesty and openness will be lacking. Team members may not fully trust and respect one another. A healthy climate lays the foundation for all of the other elements. Without a healthy climate, a team can't begin to strengthen other aspects of its performance. When a climate is healthy, team members feel valued, respected, trusted, and as a result, they are engaged and able to bring out the very best of themselves every day for their patients and for their fellow team members. Now, the next element measured by the assessment is cohesiveness. And cohesiveness refers to the degree to which the team pulls together in the same direction. Cohesiveness requires agreement and commitment on where the team is going, i.e. its goals and objectives, as well as how the team will achieve them, its values, its priorities, its best practices. Now, in healthcare, often the goal is clear. For example, to deliver the best care possible, right? But we find that in healthcare teams, where they get tripped up is the how. in demonstrating common values, priorities, and practices on the way to the goal. Cohesiveness can also be challenging for interprofessional teams. For example, if there is a lack of respect for and understanding of one another's roles and how each profession contributes to patient care. Teams can only perform at their best when there is common understanding and commitment to where they are going and how they are going to get there. And that's what the cohesiveness element measures. Now, the next element is open communication. This is one of the areas that stood out as incredibly critical to healthcare in particular. Now, communication is, of course, important in any industry. And communication is measured to a degree in all of the 7 elements. But we created a separate and unique element for healthcare because poor communication within healthcare organizations is often cited as a major contributing factor in patient safety incidents. And through our research, we found that the need to communicate clearly, accurately, respectfully, in a timely manner, along with, very importantly, the need to express opinions and ask questions freely and comfortably without the fear of reprisal, came through as critical in healthcare, because the absence of which could have a detrimental impact on the quality of care, patient safety, and on the staff's ability to do their job effectively. Now, the next element is shared learning. And this is another area that stood out as unique and essential to healthcare. The ability to learn with and from one another in a safe, blame-free, what can we learn from this manner, stood out as critical to reducing errors and embracing a culture of continuous improvement. In non-healthcare teams, for example, this type of learning comes through as innovation for the purpose of remaining forward-thinking and competitive. However, in frontline healthcare teams, learning for the purpose of improving care and supporting one another to do the best job possible came through loud and clear in our research. Shared learning reflects the degree to which the healthcare team actively reflects on experiences, shares knowledge, and provides feedback in a blame-free what can we learn from this manner for the purpose of growing, improving, and supporting one another in the delivery of the best care possible. Now, the next element is change compatibility. And as we all know, the team that thrives in healthcare today must absolutely be able to maintain high performance in an environment of accelerated and constant change. So change compatibility requires receptivity to change, adaptability to change, the effective evaluation of change, and the ability to make change stick. This element measures the degree to which teams respond openly and responsively to change, regardless of whether they agree with it or not. Now, the next element measured by the healthcare team assessment is shared leadership. Shared leadership depends on the leader letting go and team members stepping up and taking on more. Shared leadership requires that each team member is appropriately self-directed, is empowered to make decisions and solve problems, is involved in decision-making, and is an equal member of the team in that their input is sought, valued, and respected. When shared leadership is strong, the leader empowers their team members to solve problems on their own and engage them in decision-making and problem-solving. Now, the final element measured by the team assessment is team members' contribution. And this element really speaks to the degree to which team members take ownership and accountability, not only for their own performance, but for that of the teams. Are team members proactively offering assistance and support to one another, for example? Or do they wait to be asked and told what to do? Team members' contribution measures the degree to which team members individually contribute to the team's effectiveness by fulfilling their team responsibilities. Examples include keeping one another informed, sharing the load, and actively participating by looking for opportunities to improve the team's ability to provide quality patient care, and by sharing ideas and concerns. In summary, the 7 elements of a high-performance healthcare team define everyday practices that make the biggest difference to a healthcare team's ability to perform at their very best and deliver exceptional patient care. You can download an overview of each of the 7 elements on our website. And should you wish to assess your team against these critical practices, you can do so quickly and easily by using the Healthcare Team Fitness tool, also found on our website. Should you wish to learn more, feel free to reach out to our team directly. We're always happy to help. Thanks so much and have a great day.